What's going on?
What's going on?
What's going on? What's going on?
Good morning and welcome to What's Going On. My name is Dolores Vidal and our co-host is Jeanette Cranshaw. We have the pleasure of introducing to you this morning Dr. Andrew Budson, MD, as opposed to any other kind of doctor. And he will be discussing with us a topic that I think is of interest to absolutely everybody in the audience, and certainly ourselves included. He will be talking about memory and Alzheimer's disease, and he is the Chief of Cognitive and Behavioral Neurology at the Veterans Affairs Boston Healthcare System in Jamaica Plain. In addition to that, he is Associate Director and Education Core Leader at Boston University's Alzheimer's Disease Center. And in addition to that, he is Professor of Neurology at Boston University. Welcome, Dr. Budson.
Thank you very much.
So this topic is one of great interest to everybody. There's not anybody anymore, I think, that isn't touched either in themselves or a member of their family or a neighbor or somebody at work with this pretty overwhelming condition. What would you like us to know about what's going on in your field these days?
Right. I think one of the things is to just talk for a minute about why is it sort of so common. It seems more common today than it has been in the past. And there are a couple of answers to that question. The first is that people are living longer. Medical science is doing a good job of being able to keep people healthier, and so people are living longer. And Alzheimer's is one of the diseases that's more common with aging. So as people get older, they're more likely to develop Alzheimer's disease. The other thing that's happened is that we now recognize that it's not normal to lose your memory as one gets older. And in fact, what I'd like to start by talking with a little bit about is what are the changes that are normal as one gets older, and what are some of the changes that are not normal. So as people get older, a normal thing that comes about is there's more difficulty in being able to quickly retrieve information, and particularly names. So almost everybody, as they've gotten a little bit older, and I would say, starting around age 50, have trouble coming up with people's names. And I want to reassure that that is totally normal. It's also normal to have a little bit of difficulty remembering, what happened, last week or even the day before. But the key is that in all these circumstances, that if one is given a hint, or you think about it a little bit, or somebody says, well, I think it's this one or that one, that you're able to get it. And as soon as it's said, you say, oh, that's right, I remember. Yes, I remember exactly, what we were doing, or right, that's, so-and-so's name. Those sorts of things would be part of normal memory. What's not normal is that not only is there an inability to come up with the name, but when the name is given, don't even recognize it. Or if it's a name of somebody very close to you, like names of children or grandchildren, if those aren't being able to be remembered, that would be a little bit more concerning. And in particular, if there was something that happened last week or yesterday And even when the event is described to the person, they really don't remember that it occurred at all. That's the sort of thing that would be concerning, and that would be the sort of thing that you might want to get checked out.
So there are multiple, we're here in quite an academic town, and there are multiple studies going on, and people don't exactly know how to go about investigating what's going on with them, or where to go if they want to find out more or be studied better. What would you advise people to do in
Right,
such a
right. No,
situation?
that's a great question, and we are really blessed in the Boston area of having a lot of different opportunities that are available. I want to start as a doctor, as a clinician, talking about the opportunities that are available if someone is concerned about their memory, where to go about with that. And we have a clinic called the Boston Center for Memory, which is in Chestnut Hill on Route 9, and I think it's on the screen if people want to contact us there.
That's the 822 Boylston Street
Correct.
one? Mhm.
Correct, exactly right. And you can also look us up online at bostonmemory.com.
Mhm.
And this is a place that if someone has concerns about their memory, or even if they've already been given a diagnosis, a place to go where one can get care. We also offer free screening of the memory. And this is a regular clinic that takes ordinary insurance, such as Medicare. We take just about all insurance. And the goal of this clinic is, of course, to help people understand if the changes that people are experiencing, is this normal aging, or is it more than normal aging?
Mhm.
And if it's more than normal aging, we provide the standard clinical care that's available, which does include medications that can turn the clock back on the memory problem. And we also provide the opportunity to participate in new medications that not only can turn the clock back a little bit, but can also slow down the clock. They can also slow down the clock. So unfortunately, when people develop Alzheimer's disease, there is a deterioration that takes place over time. The standard medications, and these would be medications, things like Aricept that many people have experience with, that can sort of turn the clock back on the memory loss about a year. So,
Aricept?
Yeah, Aricept is one of the standard treatments to treat memory loss. The new medications don't turn the clock back, but they can actually slow down the clock from ticking so that the memory loss doesn't deteriorate as quickly. And some of the newest ones that are very exciting actually use the body's immune system to go into the brain and remove the plaques from the brain. As you may know, Alzheimer's disease is a disease where there's an abnormal accumulation of amyloid in the brain that forms these plaques. And so these new drugs can actually go in and remove it. So that's a very exciting thing, and that's something that we're pleased to be able to offer to our patients at the Boston Center for Memory.
What is plaque? I was looking online and I saw it's like a big smush of stuff.
Right, so that's a good question, and the word plaque really just means sort of, a bunch of stuff.
Yeah.
And so you got plaque on your teeth, you got plaque in your arteries, and these types of plaques are a little bit different that are in the brain, and they're not normal. So if someone is aging normally, they don't have these plaques. And these plaques are made of a protein, and the protein's called amyloid. And that's sort of the essence of these plaques. We cannot see the plaques with an MRI scan, but there's a new PET scan that's just come out that actually was approved by the FDA less than 1 year ago that can see if there's plaques in the brain. And that's something else that we can look for if one is having memory trouble and they need an evaluation. You can look for the plaques either with this new PET scan. You can also look for evidence of the plaques by looking at the spinal fluid. So that would be by doing a lumbar puncture or a spinal tap.
So that would be a lot cheaper, I would think.
It is cheaper. It is cheaper, that's correct. Although sometimes, and this is one of the things we work to try and do, either through the studies that are going on at the Boston Center for Memory or the studies that are going on that I want to talk about now at Boston University, we can often provide one or both of these tests for free. So at Boston University, in our Alzheimer's Disease Center, it's not a clinic, we don't care for people there, and that's why we've set up the Boston Center for Memory, but it's a wonderful place to engage in research. And there's all different types of research that are going on there. One of the studies that we're working hard to find volunteers for is called the Alzheimer's Disease Neuroimaging Initiative. And basically, what we want to see is what happens over time if someone has Alzheimer's disease or a pre-Alzheimer's condition called mild cognitive impairment, or if people are just concerned about their memory. And this last category, we talk about if somebody just has a complaint, they feel their memory isn't good, we're interested in looking at those people as well. So that's one of the studies, and if one participates in that study, one actually gets MRI scans of their brain, this special new PET scan of their brain, and also a lumbar puncture. And so we can see all the different aspects. And of course, some pencil and paper tests to see how their memory is doing. Now, there's other studies that are going on in addition. In my laboratory, we're looking at ways to improve people's memory, and we are using different strategies. We're seeing if people can use a strategy to improve their memory.
This is without medication.
Without medications. And we're also seeing if music can improve one's memory. In fact, I wore my musical tie today to highlight that.
What do you mean, listening to music?
So we are seeing if people can remember information better if it is sung to them rather than if it is simply spoken
Isn't that interesting?
to them. And we have some preliminary evidence to suggest that if your memory is normal, it doesn't help. But if your memory is impaired, if you have mild Alzheimer's disease, it actually does. And so we're following up on this initial published study with some other studies to see, how can we sort this out? Why is that the case? Can we use music to help people whose memories are normal or just affected by normal aging, and to try and see if we can make it even more practical and powerful as a tool.
Fascinating.
Yeah.
As a teacher, way back in the early 1960s, there was a program started up in Burlington, Vermont, working with students who had, like spelling errors, reversals, all of that kind of thing, which the public schools weren't dealing with. They said it's the child just is either stupid or doesn't want to learn how to spell. So that's all I needed to get into that project and started a program like that. Now, at the same time, this adorable private school up in northern Vermont, Burlington, needed a music teacher. And so, just for the heck of it, I decided to try music with my students who were having some trouble remembering things and conquering the reversals problem of letters and so on. And it did help. I wrote an article about it, but it's fun how sometimes you discover things just by doing something.
Yes, absolutely. And music does stimulate and engage areas of the brain that otherwise might not be participating in the task. And as a neuroscientist, which I also am, it's one of the things that we're looking at is to try and understand which part of the brain is involved in turning on when we're adding music
And
to
you
the
think
information.
of my major was in history of religions, and how all the religions in the world, except Christianity, was wary of dance, but added in for motion as well as singing. But chanting, chanting, chanting. I mean, it's just something very powerful and helpful, and engages you.
And so, believe it or not, this is just one of about 20 different studies that are going on at the Boston University Alzheimer's Disease Center. We have a study that's looking at sleep to see how sleep affects memory. We have studies that are evaluating new diagnostic tools to be able to diagnose Alzheimer's disease much earlier, and that includes blood tests that we're looking at that might be helpful, and new types of scans of the brains, new types of MRI scans, new types of PET scans. So you see there's a whole range of different research activities that people can be involved with. And we're always looking for new volunteers, and we're interested in people whose memory is normal and are just showing changes related to normal aging. And of course, we're also extremely interested in if people either have a diagnosis of a memory impairment, or even if they're just concerned about memory impairment. And I'd like to add that in the Alzheimer's scientific community, there is a lot of interest in people who have just been concerned about their memory, to try and understand, are these people noticing something that even their regular doctors probably don't? So most of these people that we're now actively studying would come into the doctor's office, the doctor would examine them, they say, your memory's totally fine. But now we're beginning to say, some of these people are really smart, and they are picking up on something. They know their own bodies, their own minds better than anyone, and when they are noting that there's problems, they may be right. And so we're now studying those people very closely. So if anybody listening is experiencing that type of condition, we'd very much like you to give us a call, and we would work to see if we could help.
The audience listening in, where would they call?
So probably calling at the Boston Center for Memory would be the right place to go. We can do the memory screening, and depending upon how the screening turns out and what they're interested in doing, we can either offer some help clinically, or we could recommend one or a number of different studies that they might be interested in getting involved with.
So the phone number for the Boston Center for Memory?
Is 617-699-6927.
Get that, everybody? 617-699-6927. Wonderful.
Now, I also want to tell you a
You'll be
little bit.
flooded.
Good. I also want to tell you a little bit more of what's going on at the Boston University Alzheimer's Disease Center. So one of our big projects is what we call our HOPE registry. And that is basically a bunch of people that have said, I am interested in research so much that I want to get involved with the program where every year I'm going to be evaluated, have my memory evaluated, have a neurologic examination, and I want to be on a list of people that are going to be called whenever there are new studies going out there that they may be eligible for. And again, we're particularly interested in people that are noticing trouble with their memory. And so if you call that number for the Boston Center for Memory, and one of the things you're interested in is the HOPE, we'll send you over to participate in this HOPE registry. And the other group of people that we're very interested in are people who have played a lot of sports, but not just any sports. We're interested in people who have played contact sports. As some of you may have heard on the news, there's been a lot of talk the last couple of years about the consequences of concussions, and in particular, concussions related to playing football. But people can also get concussions playing hockey or rugby or field hockey or lacrosse or other contact sports. And
Less so in soccer, right?
less so in soccer. That's correct. There is heading of the ball, and
Yes, that's what, yeah.
and one is a little bit concerned about that. But if the heading is done correctly, where the person really sort of fixes their spine, we're not as concerned about that. But in the other sports, concussions are very, very common. And one of the things that the Boston University Alzheimer's Disease Center has really been leading the way in the world is understanding that somebody who played sports in their 20s and 30s may actually develop dementia 20 or 30 years later because of the concussions they got in their 20s and 30s. And so we are actively recruiting for people to join our HOPE registry who have had this type of athletic history. And right now, it should be people who have participated either at a professional level or a college level, something like that, for a couple of years. And we'd love to have you join our efforts.
Do you have any applicants or considered including a branch for those that have had the war injuries, particularly to the skull, or just that the behavioral changes that come about from being in combat and so forth? And
Yes. So at the
Fix
VA
the brain.
Boston healthcare system, the Veterans Hospital in Boston, we are doing many, many active studies for that. And if people want to give us a call, and I think it's fine to use the Boston Center for Memory number and just say, I'm interested in hearing more about studies related to being in the war. We actually have a lot of research, including some that we're doing in our own lab, to look at that. In fact, there's a very similar project to what I described in terms of the Alzheimer's Disease Neuroimaging Initiative. There's a very similar study that is looking at veterans. It's called TRACTS, and that is a study that is looking at veterans who have experienced combat and some type of a blast injury or a head injury or a traumatic brain injury in the combat. And what we're working to do there is to try and understand what changes occur related to the emotional impact of the disease. Many of our veterans develop a post-traumatic stress disorder due to this type of injury. And we're also interested in what happens due to the physical effects of this type of trauma. And we actually think that the preliminary evidence suggests both the emotional stress and the physical damage can both cause brain changes. And we're trying to look at what are the different brain changes that are caused by the emotional stress versus the physical damage. And so we'd be very interested in hearing from veterans and signing them up for some of these studies if they're interested.
Very interesting, very, very useful information. I was wondering, Dr. Budson, if you would tell us a little bit about that book that I can see right there.
Sure. So this is a book that it's called Memory Loss, A Practical Guide for Clinicians. And this is a book that we wrote. I wrote with my colleague and co-director of the Boston Center for Memory, Dr. Paul Solomon. We wrote this book to try to help educate the primary care doctor, the general internist, the nurse practitioner who is in the clinic, on the front lines, seeing patients day in and day out, and to help them know how to differentiate what's normal aging, what could be early signs of Alzheimer's disease, and if there is a concern, how do we figure out what type of disorder it is, how do we use the treatments, how do we manage when there are troubles that happen with behaviors, what do we do if someone leaves the stove on, or if they start to wander, or if they become agitated or become aggressive, how does one deal with issues of driving, how does one deal with financial issues, and even how do you set up the appointment to start to investigate these things, how do you talk to patients about these issues.
Would lay people benefit from reading that?
So what I found is that although we wrote the book specifically for clinicians, I guess we did a good job of writing it very clearly and in a straightforward and simple manner, because many of my families and even patients themselves have read it and have found that it was a wonderful wealth of information, and they found it easy to read.
Wonderful.
And so, although, again, it's written and sort of talks to as if it's talking to the clinician, I do think that your viewers who would be interested in learning more about memory loss, what's normal, what's not normal, what's Alzheimer's disease, what's dementia, and how do you treat all these things, would find it a useful book. And you can find it, it's actually available in the Brookline Booksmith. They carry it, and it's available in most online booksellers such as Amazon and Barnes and Noble and BarnesandNobles.com. And I feel good that we were able to sort of negotiate with the publisher that it's not an overly expensive book. It's about $50, which for a textbook like this is actually pretty inexpensive. So we were pleased that we were able to do that.
Wonderful.
Well, I want a copy.
Me too. So you already.
Yeah, right.
Dr. Budson, thank you so much.
Sure, it's been a pleasure. Thank you.
It's been a tremendous pleasure.
Oh, we've covered so much, and yet there's so much more that could be
Well,
said.
I think so many people can benefit from this, because there's so much out there from what you're telling us that's
Yes.
being done, and that people are concerned about anyway, whether they talk about it publicly or not. It's on their mind, that's for sure.
I agree.
Absolutely.
And it requires a great deal of adaptation to absorb taking care of people with these conditions. So I appreciate your coming today.
Thank you. It's been a pleasure.
And that's it for What's
What's
Going
going
On.
on?